Weird thoughts. Back to reality. I have always been fascinated by the relationship between the mind and the body, human health, history, and psychology. My high school senior year in English 4, my term paper was titled Psychoneuroimmunology, the Power of the Mind on the Body. Later on in college, I coincidentally wrote another research paper on the same subject. To graduate with honors in psychology from the University of Texas at Austin, I had to write a senior thesis based on actual research I had conducted on intro to psychology students at the university. I found a wonderful professor in the kinesiology and health education department by the name of Dr. Steinhardt, who agreed to work with me on the research and try to publish the results in a major psychological journal. As it turned out, we published the research in the Journal of Behavioral Medicine. Guess what the title was? It was Coping Styles as Mediators of the Relationship Between Hardiness, Stress, and Illness. The research basically stated that the hardy personality type, the type we were studying, and specific coping styles insulated people from the negative effects of stress on their physical and mental health. I was heading in this direction towards behavioral medicine, and I wasn't sure why. Maybe because I was a chip off the old block of my father? Was it in my DNA or the way my parents raised me? Or could it be because I was looking for the cure for the problems that I was having in my head and in my body at the time? Was everything that I read about and did in school projects for the sole purpose of treating my own condition and one day feeling normal? After receiving a master's degree in counseling and my state license to practice psychotherapy in Texas, I took a job working with clients who were suffering from chronic pain. In that job, I was given the responsibility of teaching them how to lessen their experience of pain by using specific behavioral exercises, cognitive behavioral therapy, biofeedback, meditation, and relaxation training. Here I was again learning about mind-body therapy. I was finding out that by using these techniques all together, my clients were lowering their depression, anxiety, muscle tension levels, thus significantly lowering their pain levels. I began practicing all of the techniques that I was teaching my clients and was finding that it was lowering my anxiety and depression levels. Little did I know it at the time, but it was also lowering my OCD pain. I spent the next 8 years learning and practicing behavioral medicine for chronic pain, muscle tension, anxiety, and depression. I was finally burned out on treating